From birth, we learn how to use our bodies to enjoy our surroundings and achieve our desired lifestyle. Being able to move freely allows us to explore, connect, and be in control of how to live our life. The moment we lose any aspect of our mobility, our capacity to live independently and at our desired pace is challenged. Our loss of mobility also impacts the people around us, our family, and community. Enabling patients and residents to improve and maintain their mobility is central to overall physical and psychological health. Caregivers also benefit. The reduced need for assistance can lead to reduced risk of stress and injury, better productivity and well-being, as well as higher overall job satisfaction. For years, ARJO has recognized the importance of mobility throughout the care process, with mobility driving a chain reaction of positive outcomes for the patient, the caregiver, and ultimately the care facility. This chain of benefits is embodied by our Positive 8 philosophy, a cycle of positive effects that is catalyzed by one first step: maintaining or promoting patient mobility. Immobility has negative effects on both the body and the mind. A person that is unable to move can experience depression as well as isolation due to limited social interaction and confidence, as well as loss of control over the ability to live life as usual. Research shows that depression can affect a high percentage of people in post-recovery stages as well. This can impact their ability to regain their confidence, which is crucial to helping them regain their independence and resume their normal lifestyle. Immobility, most notably, can have a strong negative impact on the body, resulting in loss of muscle mass and power, and joint stiffness and contractures. Our bones also begin to lose density if we do not use them, which makes them fragile and prone to fractures. All of this can lead to an increased risk of falls. Research shows that accidents from falling are more likely to happen among people living with mobility challenges, and many of these falls result in bone or hip fractures, which in turn can lead to prolonged stays in acute care settings. Another common complication of immobility is venous thromboembolism, or VTE, the creation of blood clots. In some cases, parts of these blood clots may break off and lead to congestion in the lungs, or, in the worst case, in the brain. VTE is a high cause of death, and it is crucial to prevent this costly occurrence for an already sick or immobile patient. Another implication of immobility is a higher risk of acquiring infections. A horizontal posture makes it challenging for our lungs to expel unhealthy secretions, increasing the risk of pulmonary infections, such as pneumonia. There is also an increased risk of urinary tract infection. The human body was designed to empty the bowels and urinary tract in a vertical position, and the inability to do so can lead to these infections that can impact the recovery process. Further, a person that stays passive within the bed for a long time is prone to exposure of excessive pressure to bony points on their body, which in turn can develop into pressure injury. Repositioning and mobilizing the patient can help prevent this. The Positive 8 illustrates the clear connection between the effects of mobility on both a person's physical and mental well-being, represented by the inside circle, the body, and the outside circle, the mind. Helping patients maintain or regain their mobility means helping them regain their independence and improving their sense of self-worth, satisfaction, and overall quality of life, possibly resulting in a more speedy recovery process. For the caregivers, having a safe place to work without the fear of injury will also have a positive effect on both their physical and mental well-being. More mobile patients require less assistance, reducing strain, stress, and the risk of work-related injuries, leading to more positive feelings about the workplace, better productivity, improved job satisfaction, and reduced staff turnover. All of this adds up to improved quality of care, less cost, and a care facility that is better equipped to help mobilize patients and activate the positive 8 flow again and again. For all these benefits to follow, the 3 essential core elements at the center of the positive 8 approach must be present: the right care environment, the right equipment, and the right caregiver skills. The ARJO Positive 8 applies to any care setting. In long-term care, the goal is to help residents maintain their mobility for as long as possible. In acute care, the goal may be early mobilization of the patient, leading to reduced length of hospital stay. In both care settings, a focus on mobility can unlock a chain reaction of benefits that ultimately result in higher satisfaction and improved outcomes for all. At ARJO, we strive to fully understand our customers' unique needs and challenges, aiming at becoming a trusted partner that can enable the prediction and prevention of immobility-acquired conditions. Because we understand what prolonging a person's independence can mean to them and the people around them.